Can testicles switch places with each other? Meaning my left becomes my right and my right becomes my left? I'm worried this may have happened to me. But I could just be freaking myself out. There isn't really a lot of pain, and the discomfort could just be me making it up in my brain because I'm very squeamish about this. I just really need to know the truth if they can switch sides or not. I have to know. I'm not talking about epididymitis or even a testicular torsion here. I am familiar with those. I really thought I watched my testicles switch places. Please help me. Please. I'm very afraid of hospitals.
Hi, I'll be glad to answer your question. It will be advice only as we can't examine or treat you but will help you get care from your local doctor. No, testicles don't switch places. It's amazing you know all about testicular torsion. I've met doctors who haven't known about that. I think the most likely thing is that you have what is called bell clapper syndrome. That is where the testicles are freer to swing around in the scrotum than they should be.
You are positive about this information? And with bell clapper it would mean my testicle is free to turn around on its axis. Meaning it could cause testicular torsion. But would it make it possible for them to switch places?
So one could theoretically go over to the other side somewhat, but it should go back.
You don't think they would cross over and just swap then?
Am I positive? The only way to be positive is to open the scrotum and examine the testicles, but a good manual exam would find them moving too freely. Well, they wouldn't stay on the other side but swing back. This would theoretically lead to an increased risk of torsion. But all things with risk, fortunately, do not always happen.
So, most likely, my testicles are in place right now and not swapped? I've been having very terrible anxiety about this. It happened last night. I'm worried if something has happened, I could be too late.
One of the advantages doctors have is that they examine a lot of scrotums, especially urologists. So they can tell the difference more easily than an individual patient can, who is often familiar only with his own scrotum. No, don't worry about that. You'd know if it were too late. That would be if it torsed and the blood supply were cut off. You'd be in terrible pain. It's only too late if that happens. But if they freely swung without torsion, it wouldn't matter at all. The sperm from the right side would still go up the right tube and the sperm from the left would still go up the left. No way they could switch those. Guys often worry about things like this. But if you have discomfort often enough, you can consider having them tacked down so they don't move much. Meanwhile, support like jock straps.
I guess I can see what you are saying. So do you think I am freaking out too much? And just working myself up?
I've seen guys in ERs with torsion and man, they know it. They are typically screaming. Just like if your testicle is squeezed too hard or hit with a ball.
I'm glad to know this. A lot of people were saying that. But I'm still a bit concerned. Frown.
Of course.
I'm not really sure what to do.
See a urologist at his office. Since you're afraid of hospitals, have him examine you. Discuss your discomfort. Decide what you want to do. Meanwhile, jockstrap.
Really, it's more so I'm very uncomfortable with any doctor when they are in person.
Well, you're very young. Did you have a bad medical experience before? They can also ultrasound the testicles and tell you they are A-OK and reassure you with no radiation. But I've never met a guy who didn't cherish and worry about his testicles. Well, I do live in the SF Bay Area, so maybe a couple.
I have had several really terrible medical experiences. I don't trust doctors much, because they seem rushed, overconfident or complacent and don't know as much about my body as I can look up on my smartphone through Google. It's terrifying to think someone underqualified and incompetent may be screwing me up more.
That's a shame. There are wonderful doctors and terrible doctors in this world. Just like any other profession. Difference is, doctors handle people's bodies and pain.
In Toledo they are not really that great. Most of them won't see me because I am in debt. Also, one other question, before I pay you and go.
What I would do is go to a medical school center clinic and see a young resident and talk with them first before getting undressed. I used to freak out at doctors who got patients undressed before meeting and talking with them. See if they're nice, explain your fears. Sounds to me as if you don't have too much to worry about though. You have enough ejaculate? It's not all sperm though, as you know, but this kind of helps to tell. _.
Alrighty then. Thanks much. I don't have to go to the ER then, right? Like if I'm not in pain? I haven't tried ejaculating yet. I've been too afraid. And I've been sorta having some self-confidence issues in that department lately. I'm not sure if I would be able to.
If you're not in pain at all, I think the cost of an ER would not be cost effective. If you are in pain, it can save your testicle. Look up the med school clinic. You've never ejaculated? Never awakened after a wet dream? And ERs are for emergencies. They kind of pass off non-emergencies to follow up in clinics/offices, and so it's a waste of money. But if you have an emergency, you must go to save your testicle.
No, I have ejaculated. I have a daughter. I just mean I haven't ejaculated in about a week, and this only happened last night. I was saying I don't know if I'll be able to ejaculate because of my self-confidence issues as of lately.
Are your testicles tender to touch and move? If not, don't worry. I bet you just had an episode of overactive cremasteric muscle reflexes. It sounds as if you've gotten into a cycle of worry, without real pain.
There is a chance. I had epididymitis once, and I may have it again, I suspect. I'm not sure though. I'm not sure how ejaculating would help me figure something out. Would I be looking for something different? Something.
I just wanted to make sure you could at some point ejaculate. Remember, I don't know you, but what you've said sounds like they function fine. If your epididymi, or 1, are tender, You might have it, but you're experienced at it, so you should know. Orchitis is also something guys usually are sure about having something worrisome for sure.
Ah, okay. So if I can ejaculate, then things are most likely working just fine? Well, I'm sure I could always try if I were able to get an erection. But I suppose thanks for your time. At least I'm not going to go to the ER now.
No, you don't have to try. You have to relax and not be tense. If nothing is tender, then most likely things are fine. What you saw may never repeat itself, if you saw anything really worrisome.
I don't know how to relax. That is the problem. My life is too hectic for that. Thank you though.
Honest, you haven't told me anything that sounds serious or worrisome. No pain, no swelling, no discoloration, no ejaculating blood. Just a guy worried about an important part of his body. If sudden pain comes, go to ER.
Well, somebody has to be worried about it, lol.
Forgot, no discharge.
Thanks. I will.
Learn to relax. Meditate. Fall in love, again?
See. How would I know if there was discharge? Sometimes it feels like I could be dripping, but when I feel it, I am not.
If you said someone else was worried, I'd know you were in love now. Well. If you were, you'd feel wet, stain underpants, see something on tip. You are a worrier. Quit it. Wait for your body to tell you.
I will try and find time to relax if I can. I'm just not good at it. And I am married. I just don't think she is very worried. But thanks. I will try to stop worrying so much.
You have maybe 80 more years on this earth. Learn to relax. I'm glad you are married. If she didn't find anything wrong and you didn't, odds are nothing is wrong. I do need to go now. If you have more questions, ask and I'll answer when I return.
Thanks. Bye.
Honest, meditating sounds lame, but it works. Bye. Why did you rate poor service? Was there something you needed to get answered but didn't? We spent a lot of time in discussion. This bothers me for you to rate my time as poor.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.